Good morning and welcome to the second day of our conference, Trust and Transformation. And today we are going to focus on transformation. And I promise you, we have a packed day, lots of very interesting sessions, action is coming. And I just look at the program and I see we will talk about the investment. We will have also plenaries on making transformation happen. And we have plenty of really exciting parallel sessions like climate resilience and environmental sustainability. Can people afford to pay for healthcare actually? Precision medicine, and one on delivering service transformation. So that's really, really great, and we are looking forward to it. But this session is really about navigating transformation. Like having a plan, a map, knowing where we are, knowing where we want to go, why we need to go there, and also understanding whether we are actually making progress on our way. And to be rather a little bit precise and be clear on the side of concepts and terminologies, we will use this opportunity to launch 2 policy briefs. One policy brief is a framework for health systems performance assessment. It's a renewed framework. And a second policy brief, which is a kind of proof of concept, where we try to make explicit how we can actually use health systems performance for transformation, for health systems transformation. And it's all about the policy questions, the tracer indicators, and the data needed behind it. And I see that my colleague and wonderful co-moderator, Kira Koch, is already getting a little bit nervous because I'm taking so much time, but please bear with me because I want to connect this session back to yesterday. And I think we all agree we had a fantastic day yesterday. Wasn't it an amazing opening? We had input from the First Lady, from the Minister, testimonies from patients and professionals, and we all instantly agreed trust is really key to health systems and health systems transformation. And then we had a great panel exploring actually where are we at the moment in the world and in Europe with trust in health and health systems, and where do we need to go and what can we do? And for me, it became crystal clear during the 3 parallel sessions on diabetes, cancer, and mental health that trust and transformation are intrinsically linked. You need trust in health and health system for the transformation, and you transform to generate or maintain trust. So I think this is the linkage we are seeing today. And now we are looking into health systems performance assessment to see how this can really drive transformation of health systems in a very concrete and applied way. And this is the moment, Kira, where I would like to hand over just one word. You probably expected Joseph Figueras, my director, standing here. Unfortunately, he was unable to come and he asked me to step in. Nobody can replace Joseph. I just jumped in and I hope that I will help a little bit. Kira, please.
Thank you so much, Matthias, and welcome everyone to day 2. And I'm very pleased that you are jumping in, Matthias, in order to have our very exciting panel discussion today. What we would like to do in the first section is actually to have a presentation of 3 speakers. I will introduce them in a minute. Then afterwards, we have already a beautiful panel discussions and panelists lined up where we are very much looking forward to having a discussion actually on the transformation and how we can use health systems performance assessment in order to drive performance improvements. And then afterwards, actually, we would like to turn to you as well in order to listen and get some reflections, some questions that we then would like to pull back to our panelists afterwards. So please be ready in order to have your questions then at that moment in time ready to go. With that, I would like very much to start the first part. We will have a presentation which will be done by 3 colleagues, and it's very much a pleasure for me to introduce them. It's Dr. Deepa Rajan from the European Observatory on Health Systems and Policies, Marina Karanikolas as well from the European Observatory. And then we have David Novillo, who's the unit head of data analytics and digital health from WHO Euro. Deepa, if I can invite you to the stage first, in order to present us, Matthias had already alluded to it, that we will have the renewed health systems performance assessment framework. I know the first version of the HSPA actually came out during the pandemic, and this was done through a working group that was convened between WHO and the observatory. There has been a lot of updates now, and we look forward for you to walk us through some of those updates of the renewed HSPA. Over to you, Deepa.
Thank you, Kira. And indeed, we have worked through a technical working group together with WHO and the European Observatory. We put out our main study during the pandemic, what you see on your screen, which is available online. And this working group basically did, first and foremost, a review of existing health systems assessment and performance assessment tools. Those tool owners, so to speak, were actually in our working group. And with them, we did literature reviews, expert consultations, and spent 3 to 4 years working on this original framework. Their aim was really to get a harmonized approach. A harmonized approach to what? To analyzing and assessing and presenting health systems data and information that you have in your countries that are being collected, so that this data and information can tell you a story about performance. And that was really the point of this framework. And we have now renewed it. And why? Because, as Kira said, the original framework came out during the pandemic, but in the last 3-4 years, we know that the world has changed. We know that there are many additional policy concerns of all of you sitting in countries which have become more of a policy priority. Things like governance, multi-sectoral action. We hear a lot about One Health, for example, the voice of people, patients, communities, workforce. We heard a lot about this yesterday. Digital health, the environment, health security, of course, resilience. So let's get right down to it, to the framework. So first and foremost, I'd like to draw your attention to this part of the framework, which is actually outside of the health system, which is this rectangular box. So firstly, we draw attention to societal goals, because ultimately, why do we want to improve the health of the population? Because we want to improve their well-being. We want to improve societal well-being. We want to contribute to something greater. And so we've fleshed out in this renewed framework, which is in the policy brief on your seats, the societal goals by looking at the sustainability literature, and you can find that in your brief. Now, let's get back into the health system. We have on the left the 4 functions of the health systems: governance, resource generation, which is the resources such as workforce and pharmaceuticals, etc., financing, service delivery. These 4 functions come from the World Health Report 2000, so they're nothing new. We're not reinventing the wheel. Governance is placed furthest to the left of the framework, quite purposefully, because it is the most enabling of all functions. It really enables and facilitates the other functions to reach its maximal performance. Service delivery is placed to the right of the 4 functions because you can see it as an outcome of the other 3 functions, if you so will. Then you see a little bit of governance in all of the other functions besides governance, and this is because we see a role for overall systems governance, things like human rights legislation, the right to health, overarching national health policies. But then we also know that there's a strong role for governance linked to the other functions. For example, health workforce planning would be governance within resource generation. Now, all of these actions and interventions that we do as policymakers within these functions link to what? To these goals that you see further to the right of the framework. Now, the green at the very right of the framework we see our goals, we see health improvement, of course, financial protection, we see people-centeredness, very important. People-centeredness in the World Health Report 2000 was called responsiveness. This is a measure of people's perceptions of how responsive the health system is to their non-medical needs in their interaction with the health system. We heard yesterday how important that is, and this is measured from the point of view of people. So very important final goal of the system. And of course, we have equity and efficiency, which are cross-cutting goals. Then we've delineated the intermediate goals from the final goals, and you see the blue in the middle. as intermediate objectives, and these you can see them as direct outcomes of service delivery. So we have quality with its different subdimension of user experience, safety, effectiveness, and you have access. Now, a very important point of this framework, and I think this is a clear added value of this, is all these lines, these busy lines you see all over the framework, these dotted lines, these solid lines. These are the linkages between the different elements of the framework. And as Natasha so eloquently said yesterday, with the bricks and mortar analogy, the simple elements of a system alone is not going to give us performance and resilience. And this is why we call these linkages performance and resilience links. It's the way the system and the different elements are linked together is what gives us that performance of the system, is what gives us that resilience to external shocks. And so you see these solid lines linking the different functions together, the different dotted lines. I don't have time to go into full detail, it's all in the policy brief, but let me just highlight illustratively one of them. You see a dotted line going from the governance function, going down and going outside of the system into the determinants of health. And that means that we have a great lever with the governance function through multi-sectoral collaboration, for example, to impact on the determinants of health, even though most of the action to address determinants of health is outside the system. However, through governance, we can still impact on that, and that impacts, you see that line going back into the system to affect health improvement, because it has a great impact on health improvement. And that's just an example of one of the linkages, the rest of which are all in the policy brief. Now, ladies and gentlemen, health systems are complex. We cannot get away from complexity if we are to assess complex health systems. So in order to really understand the impact of what we do in the health system on performance, and to really understand resilience, and to really understand causality, we do need to go beyond the functions. And this is where we have delineated a number of sub-functions, starting with governance, for example, where this area of governance is traditionally in systems assessment has been quite underdeveloped. We know that through the review of tools that we did. The sub-functions of resource generation and financing are fairly straightforward, and then we have service delivery, public health, primary care, secondary care. And I will leave you with one final point. In order to be able to assess systems which are complex, we need to link these sub-functions to indicators. And to do so, we've put out something called assessment areas, which basically are the topical areas for assessment that matter, that gives us the information on these sub-functions that will allow us to understand how it affects performance. I won't go into details here, I'll skip over this one, but just to give you an example, for multi-sectoral collaboration, we need to understand whether it exists and what the quality is, and these can be linked to indicators, and this is what my colleague Marina will be talking about in a bit. Thank you very much.
Thank you very much, Deepa. There's a lot in, and it's a great framework. I'm a bit biased. But the main question now is really, how can we use it? How can we make it operationalized? Because it's great to have a framework, but the beauty really comes in when it is being used. So it's a pleasure, Marina, to enlighten us a little bit more on how the framework can be operationalized. Over to you.
Thank you so much, Kira, and thank you, Deepa, for already introducing the framework. So I'm going to move on from there, and because I only have 5 minutes to go, please take it as a work in progress and as a test drive, and it's going to be quite a fast drive. So the framework, we're using it as a blueprint, and the benefit of it allows us to do those linkages that Deepa put so nicely, and we can then highlight the pathways to show how health system performs and to start getting into the causality of suboptimal performance. And also, those linkages show that health systems performance is dynamic, so we can understand better how health system works and how well it works, irrespectively of how it is structured. And also, the framework helps us to put indicators, to plug indicators into different areas of the framework to understand better how this all linked between each other. So this is the second brief of today, and hopefully you have all seen it already and maybe look through it. And this brief is a joint work with OECD, so it reflects both approaches, and it shows how to operationalize this framework. So we use a subset of indicators because HSPA is traditionally seen as very thorough, very rigorous exercises, and they're almost expected to go into the every detail of how health system works. And this is great for people who like data and indicators, but this is less great for people who don't have much time, for people who don't want to look at hundreds of graphs. So the subset of indicators in that sense, would be more beneficial to look at from the policymaker's perspective. And the way to organize those tracer indicators is what we call policy questions. So if you have a burning question that you want an answer from, it would help us to adjust the indicators at the right level to see how health system performs. And in the brief, we look at only 4 areas to start with. So one is health workforce, another one is digital health, and then is people-centeredness and access and effectiveness. And finally, this helps us to populate the framework with the indicators. So I'm going to go with example of digital health because of time. And here is the framework that you've already seen from Deepa. So for example, where is digital health? And if we want to ask a question, for example, how we're using digital tools to optimize delivery of digital health services, we would start probably from service delivery. And the questions that we want to ask there is, are digital services accessible? Are they being used by staff and by patients? Do digital services ensure optimal quality of care, so they still have to be effective and safe and still respond to patients' needs? And do the digital tools enable integration of care or coordination of care? So these are the questions that we would be asking around service delivery, but that is not enough. So the framework takes us into other areas as well. So in terms of, for example, infrastructure, in resources, what things that we want to know there are, for example, is digital infrastructure for the tools even available? And is it maintained well to be able to use, and are staff trained to use it? And again, this is still not enough because we don't know about the financing and investment into the infrastructure. So some of the questions that we might want to ask also, what is the level of investment, and do payment systems respond well to ensure that we fund digital services the right way? And like this, we're going through the framework and different areas. So with the example of digital health, you can see that it's not enough just to look at one place and one area. You need to also look at the linkages across the system and how they contribute to health system performance. And now that we have the idea of the framework and the pathways, we can start looking at the indicators. So going back to service delivery, the indicators that we might want to look at, the tracers, so is use of electronic records, for example, or the use of telehealth, or the levels of electronic prescribing. And again, if we look throughout the system, we also still need to address the infrastructure, because in countries in some lower income settings, we can see that facilities are not always connected to the right networks, they don't have the right equipment or the right software. And again, going to financing, we need to see how the reimbursement works for digital services, because what we've seen in COVID is the system needed to restructure very quickly to be able to fund digital services, and they just didn't have it in the right place. So just some final words is we use the health systems performance assessment framework to put in the tracer indicators and the level. We use the policy questions to put them at the right level and in the right places in the framework. So also we work with the linkages, and we link the health systems, the functions, to the objectives. And I didn't get through to the objectives because of the lack of time. But also we need to understand that lack of, for example, in the example of digital health, poor performance of digital services would still reflect in the intermediate goals and in the final goals of the health system. And that would bring us to the value of investing in certain services. And finally, finally, the point is to understand also the limitations of the tracer indicators, what they show and what they don't show, because these are only the flags and they point to different areas of weaknesses, but then we need to understand where the gaps for the information is and where to look for that information if we need to. Thank you very much. This is it from me.
Thank you very much, Marina, and thank you both. I think there's a lot of information and a lot more of information in the policy brief, so I really invite everyone to peruse through them. There's an end-of-year break. It might be a good opportunity in order to also look into those policy briefs. And with that, I would like to actually stay with the data and the data practicality and move to David. We know that data availability and quality is always a challenge in countries, but it's very important. Having good data is important to identify root causes in order to improve performance. Now, David, I would like to hear a little bit more from WHO Euro's recent efforts to explore innovative approaches to leverage digital data sources to complement our current or traditional data collection methods in order to improve informed decision-making. Over to you, David. Thanks for being here.
Thank you. First of all, as a proud partner and colleague of Deepa and Marina, thank you so much for presenting the work. So as Kira was pointing out, right? So today is about transformation, right? We need to continue working, of course, in health systems performance assessments, an important piece of work, but then we need to see another approaches that could complement, not to substitute, but to complement the great work that is already happening. So this brief presentation, 5 minutes presentation, is about that. Let me start with the opportunities, right? 2015, all the member states agreed to sign the Sustainable Development Goals. 17 goals, 232 indicators to achieve and improve the health of the population, right? We're in 2023, almost 2024, and I have some bad news for you about data and this. So first, when we are looking at the country coverage of the available SDG data, we only have data for 66% of countries. So we are trying to make progress, but we cannot measure progress. So that is an important challenge. But also we know, when it's about the timeliness of the data, that only 30% of the available data is from 2022 or 2023. And most of the data is actually from 2020, if we are lucky. So what is the reality when we are talking about achieving Sustainable Development Goals? But then we have some positive news. When we are looking at technology and the connectivity, and even though it's not full for the global population, we can see that almost 67% of the population is connected to internet. And from this percentage, around 62% is already using social media platforms. It can be Twitter, now X, Facebook, Instagram, TikTok, you can name it. There's plenty of platforms. And are we taking advantage of these platforms? I don't think so. So we have an opportunity to complement our traditional approaches in how we are collecting and using data for improving policy decision-making and continue improving our health systems. In 2021, actually, you asked our regional director to continue exploring the use of digital data sources, the data that is available in these social media platforms, to complement classic data collections. And that is what we are trying to do and what I am briefly presenting today. Basically, what we plan to do is to look at the data that is available in social media, of course, in a very anonymized, ethical, and secure way for all the users, and to try to extract key ideas and sentiments of the data that the people are actually sharing on a daily basis across the social media platforms. And the idea for this is to complement, as I said, the policy decision-making that we are doing around health systems. This is just a proof of concept that we are trying to do, and of course there is no way that we will have time to talk about it, but we already conduct a pilot about trust in health systems, looking at the WHO European region, at the 53 countries, and in this pilot project, in this first proof of concept, we have seen that of course there is a lot of opportunities to continue improving our health systems, but we cannot look to another side. So we really need to listen to the population to understand what are their concerns and try to build from that. As WHO, we are an organization that we are constantly listening and learning from what the population, the member states are telling us. So I think that there is a good opportunity for all of us to look at this data and continue improving it. How we can get there? So definitely we need to continue improving data governance framework. And the idea is that we can see that even though we're in the European region, we have several challenges we need about data governance and how we're structuring the data. And we saw all of us during the pandemic about how the data was structured, collected, measured, etc. So there is space for improvement. Also, we need to continue investing in data infrastructure. We can see all the time data and digital health in all the speeches, and we are so grateful for that. But honestly, and this is a personal opinion, I miss that in the budget. I know that we are competing with, of course, very relevant priorities, but we need to continue investing in data and digital solutions. We cannot make progress if we cannot measure progress, and that is the reality. And also, we need to continue integrating different data systems. So we know that we have national realities, subnational realities with regions, so we need to find a way to make these connections. And coming from Spain, from a country that is decentralized, we can see the challenges. But we need to continue keep going to ensure this standardization between national and subnational levels. And finally, we need to continue combining these digital data sources, as I said, the data that we can extract from social media platforms, to complement the traditional approaches in how we are collecting data. So I think that from Almaty Declaration in 1978, the thing that has changed the most is the availability of health data, health-related data, and the technologies. And so there is an opportunity in front of us to take advantage of that. So looking forward to supporting you in this journey, and if you're around, we will be around, so happy to talk to you if you have any interest in what we're doing. Thank you.
Thank you so much, Deepa, Marina, and David. And we moved from the conceptual framework to testing it in an application in a dashboard form, to new forms of data collection, to bring it into these tracer indicators. And now we're coming here actually to the real world. We are asking a question about the development, implementation, but also already application of health systems performance assessment. And we start here from the top level, so to say, the international agencies. And we have, well, I don't need to introduce you, Maya, but I do it anyway, Maya Matthews from the European Commission. She's Deputy Director and Head of Unit. And actually, health systems performance assessment is one of the things you do almost on a daily basis. I know on Friday you are launching the country health profiles as part of the State of Health in the European Union cycle. Together with the OECD and the Observatory, we produced them for you. And they are snapshots. They are snapshots of health systems performance assessment in it. And I can only recommend you to look at it. But you also run an expert panel, actually. And can I ask you, first of all, a very naive question? Why are you doing this? I mean, you have a very small political mandate for health systems, and you invest quite a lot helping countries. What is your motivation? Please, Maya.
Thank you. Thank you very much, Matthias, and thank you for saying half of what I was going to say. So I can skip that bit about the state of health. But I think your question is fundamental. And I think that we only have to see what happened in the last 3 years during COVID to explain why it's so important that the EU is working together on supporting member states in strengthening their health systems. COVID was a huge wake-up call for everyone. It really shook the foundations of many governments, but also the citizens. There was a huge outcry that what was the EU doing, and we realized that, yes, as you said, we don't have the treaty mandate to go very far, but what we showed is that working together and cooperating together, we can go very far. And so part of my motivation every day is to try to bring the best evidence together to support member states in strengthening their health systems, so that when the next pandemic comes or when the next health crisis comes, countries are much better prepared. And we do that through, as you said, evidence generation and analysis. And so on Friday, we're launching the 29 country profiles and a synthesis report, which tries to bring together some key takeaway messages. And I take this opportunity to thank very much the OECD and the Observatory on Health Systems and Policies, who are our partners in this endeavor. It's now, we're going into the 8th year of this, and I hope that member states, but also other stakeholders, appreciate the amount of work that goes into these country profiles. And really, again, coming back to some of the issues that we heard, it's about providing information which is valid, which is reliable, and which will support policymakers, but also researchers, civil society, in looking at how we can improve health and health systems. And for this year's edition, we have added a spotlight section for each of the country profiles on mental health, because as we heard yesterday, the importance of actually speaking more about mental health, but we also need the evidence. So I think one of the cross-cutting themes of all of these 2 days is that you need data. You need data to build trust. You need data also to build health systems which will respond to the needs of patients. And to give you 2 examples of how we are trying to operationalize this in the Commission, as you said, we have an expert group which is co-chaired by the Commission and also by a member state representative, Dr. Kenneth Grech, who's here, co-chairs with me. And some of the members of the group are here, Modesta and Pascal. And through this group, it's really, I always say that working for the EU, I love it because it's like a natural laboratory. We have so much innovation at all parts, within all parts of the EU. And so bringing together member states to discuss how we can do things better, sharing best practices. And just to give you one example, this group, this expert group, decided to look at resilience in 2019, so before the pandemic, and was able to actually have a very good definition, which is now used in many, many literatures and also will continue to be used, that resilience of health systems is not just about preparing for pandemics, it's resilience in many areas. Workforce that we heard, how do we build resilient health systems that have the capacity to respond to surge when needed, and also climate change. So many of the themes that are coming in, I know I'm running out of time, so I'll be very, very quick.
I need to ask you back.
Oh, you need to ask me back, okay. But I just wanted to say that, so one of the things that we are supporting, again with OECD and the Observatory, is something that came out of an expert panel that we were running, that Martin McKee, who's sitting here, was part of, that identified the need for a participatory approach to resilience testing. So member states are empowered to look at their own health systems to check where are the levers, where are the vulnerabilities. And so we're very happy that this work is ongoing now between that the OECD and the Observatory have been leading to look at tools and methods that member states can use to test their own health systems.
Maya, one of the cross-cutting themes yesterday was that transparency is really key for developing and maintaining trust. And I mean, you are creating a lot of transparency. And do you feel that there's some feedback from countries where you think, oh yes, that's number one, trustworthy information, and number two, it helps us actually in our country?
Yeah, I mean, I think transparency is key to everything, and maybe I can just also share, because David's speech was very inspiring, that the whole area around digitalization, we really need to bring this forward. And so we have the European Health Data Space proposal, which is actually being voted. The European Parliament is voting on their report today as we speak in Strasbourg. And this has a two-pronged approach. As you said, it's about transparency. So it's really about empowering people to have access to their own data, because I think that is the key, that's the starting point.
Thanks a lot, Maya.
And I would like to actually continue with you, Mark. Mark Pearson, Deputy Director, Employment, Labour and Social Affairs, OECD. Great to have you here. And I think we all know OECD is very well known for compiling the extensive, large data sets that you are covering various health topics, very much relevant to assessing health systems performance, which also then facilitates actually that comparative analysis across countries. So my first question to you, and I think we all also know the health at a glance. Maya just mentioned the state of the EU in in health country profiles, and the reading list, I'm afraid, is getting longer for you as we go along. But Mark, my first question to you, could you elaborate a little bit more on how some of the outcome indicators you monitor can actually be used for policy purposes to better identify the nuanced performance issues, and more importantly, of course, how we can trigger the policy change?
Well, first of all, thank you very much for inviting me here. It's a great pleasure, great conference. And also, I do want to start by saying how much we are looking forward to launching the health profiles on Friday. I think DG Santé's definitely got its act together recently. It's doing really fantastic work, and a lot of it actually is down to Maya here. So really good to be able to work with you. On your question, I mean, just a few. One of the things that I think we have to recognize when we talk about health data, we do have multiple audiences. And I think we all probably underestimate the thirst that's out there in the general public for information about health. You mentioned Health at a Glance. We launched the last edition on 7th of November. In the first 3 days, there were 1,500 separate media articles based on Health at a Glance in 62 countries. Way more countries, sorry, excuse me, way more countries than are actually included in the report. There were 29 languages, massive social media involvement. There were 35,000 downloads of the publication. That's not page views of the publication, that's downloads of the publication. To put that in context, to get on the New York Times bestseller list, you need to sell, depends on the week, somewhere between 1 and 10,000 copies. We're not up there, at the moment it's Britney Spears is number 1. We're not quite up there with Britney Spears. But if we were selling this, it's not, it's for free, it would be very high up on the New York Times bestseller list. And I don't think we realize that there's that huge thirst for health information. The trouble is, as we all know, not all indicators are the truth. They're not the truth, should I say. They're correct, we hope, but they're not necessarily the truth. They're not incontrovertible. They're not unvarnished. They need interpretation. And I think, you know, that came up again just with Health at a Glance. A journalist from Southern Europe, I won't mention which one, rang me to say he wanted to write, he'd already written the article, the why oh why article, you know, why oh why are we so bad compared with other countries? And now he wanted to do something a bit more positive and uplifting. And he wanted to pick up on the low rates of cardiovascular deaths and how this was showing the health system was really good. Well, yeah. I mean, we all know the countries in Southern Europe, Japan, Korea, they have very low rates of cardiovascular deaths. But they have very low rates of obesity and other risk factors. To say that it's due to the health system, yeah, in some sense, maybe, but not in the narrow sense of the performance of the health system necessarily. Because when you look at things like 30-day survival rates after AMI or stroke, lots of room for improvement. And I think that's why you need that sort of framework, the HSPA framework, the framework that brings things together so that you can actually nuance some of the policy messages and actually focus in on what really matters. Is it the absence of stroke units? Is it the performance of the ambulance system and so on? But, you know, in terms of the narrow question that you asked, what's the influence? I mean, I don't know, pick your country. I mean, generic usage in France and Switzerland, biosimilars in Belgium, long-term care, home hospitalization in Portugal, alcohol use in Ireland, inappropriate use of antibiotics and benzodiazepines pretty much everywhere. And I think, you know, clearly they do move policy. We just have to be careful that they're moving policy in the right way and we don't get an over-obsession about particular indicators. It's not a competition about getting higher up in the league tables. It's about improving the health system.
Mark, maybe one question, because you've mentioned the indicators, and Marina had just presented the joint policy brief also with the OECD. A quick reflection on the development and the importance of the tracer indicators.
Yeah, I think that is important, because the idea of the tracer indicators is that they are actually reliable as a measure of performance. They don't need quite so much context to interpret them. Look, I mean, OECD's got its own health system performance assessment framework that will be endorsed by ministers at their OECD ministerial meeting next month. It's slightly different from the one you've just had presented here, but frankly, it doesn't really matter. It's touching on the same sorts of issues, and certainly we identify the same sorts of indicators. So I think, working together, we can bring together the force of all the different organizations to really get down to what tracer indicators are really important. And I think that's something that's going to be particularly important for those new areas that we all need to cover. Yes, resilience, but climate change, the patient-centeredness, patient voice type issues, incredibly important. They're missing at the moment from our frameworks. And that matters because, if they're missing from international frameworks, they're probably not getting the sort of attention domestically that they need. And so the point is not, we don't do this just for fun, as Maya and others have been talking about. We're doing it in order to support you making policy and be able to compare yourself and learn from each other. And that means that, I hope we'll be able to make more progress on those tracer indicators in the coming months.
Great, thank you very much. Over to you.
Thanks a lot, Mark. And now it's time to welcome Modesta Visca from the Ministry of Health in Italy. And you are actually there part of the Directorate for General Healthcare and Planning. And we already heard from Maya that you're part of the expert panel. And I want to hear a couple of things from you, because number one, you are highly decentralized countries in terms of health systems, and many countries in Europe have this feature. So how can you actually help from the national level to the regional? Yeah. And then we heard from Mark that performance assessment is really driving policy development, and maybe you can also fill us in a little bit on this, Modesta.
Yeah, thank you very much for the questions. So in Italy, we are facing a big reform in healthcare sectors. Especially, we are moving from hospital-centeredness to community and community healthcare and territorial healthcare. So we have to redefine our HSPA system in order to respond better to the patient need and to use that data in order to do better policies. So first of all, HSPA is very useful in order to align our tracer indicator to have a comparison, not to be alone in order to monitor that item respect to another one, to give priority to what we have to monitor first in order to look not only to productivity, as we told yesterday, but also to put in something more. What we are trying to do is in the way of patient-centeredness, so going to insert new indicators that are going to monitor clinical pathway, also considering mental health and Parkinsonism, something related to dementia problem that are incident problem that are weighing on the healthcare, allocating new resources, and also we are inserting trust, something that is going to, as you told yesterday, insert humanity in our health performance system, because we are not punishing our region. We have to work together with them, coordinating their way of their process in elaborating new indicator in order that all the region going in the same way, and that is a big problem for us, that we have a high variability in service delivery between the regions.
What's the incentive of the regions working with you on the performance health system performance assessment?
We have a national monitoring system, and a part of the result of this monitoring system is related to a small amount of financing to the region, right?
So a little carrot.
A little carrot, yes, right. And so we use that to insert a new indicator in the core benefit that is monitored, the core benefit package that we deliver. And we are going together with a project that we are performing with OECDC on the ambulatory sector, primary care set in the Paris project. We are trying to insert one indicator concerning trust on our service delivery in that. And so we are start to feel in the next years that indicator.
Modesta, I understand you have changed the tracer indicators in the policy question because you introduced new models of care.
Yeah.
Changing this, very important. You use incentives that the regions are working with you. Can you also see that in the regions, decisions are taken on the basis of these indicators, so that the indicators are not only showing where we are, but also giving some directions?
Not necessarily. What is working more together with the National Agency for Regional Healthcare and other public health institute is to work together with them, building together the HSPA performance assessment. And so the framework that we are building together in the international context is our light that indicate us the way that we are doing well, and we have to redefine something in order to, for example, it's very important to define together with you indicators on digitalization, because it's a new asset that we are not monitoring. We were not monitoring till now. Now we have to monitor because we are investing a lot of money on that. So
this must be quite satisfying to hear that the international frameworks are actually making their way to the countries and to the regions and have some impact, of course. Please, Kira.
Yeah, thanks very much. And let me come over to hear from our second country, Pascal. Pascal Meos, Senior Researcher, National Institute for Health and Disability Insurance. It's wonderful to have you here. Pascal actually has been part of the HSA working group when the Health Systems Performance Assessment framework was being developed. And I've learned personally a lot because Belgium has a huge experience, especially in health systems performance assessments, and actually doing it regularly and in depth and releasing those health systems performance reports. There's actually one coming out in January at very specific times in order to also influence the policy and the decision-making processes. So my question to you, Pascal, in the first place is, what are the key lessons from the experience in Belgium, in particular to the extent how HSPA is being used and linked and is influencing policy? Do you have a concrete example for us?
Okay, thank you. And thank you for giving Belgium the opportunity to testify about the HSPA experience. Well, in Belgium, we followed directly the Tallinn Charter, the first Tallinn Charter, and putting the HSPA on front to discuss about accountability, transparency, and monitoring. And this report is published every 4 years and fit to the political agenda. And indeed, HSPA is an essential tool for policymakers as a global and comprehensive report. And you need precondition so that HSPA will be endorsed by policymakers. And let me first talk about that before the concrete example that I can tell you. So, trust in HSPA for policymakers was immediately put in front when we began the experience of HSPA in making a survey with the policymaker to see their fears and also what I wanted from the HSPA. Secondly, the report was done by an independent scientific body, which made it more credible. And there is also a recurrent budget for this project, which is quite important. And also, you need a strong leadership to do this HSPA and to be not understood, but endorsed by the policymaker. So concrete examples. Well, the report in Belgium tells us about warning signals, priorities, and maybe one of the main topics to put forward as a good example of influence on policymaking was perhaps the results on the GP practice. In 2012, we were in a very bad position. Only less than 25% of medical graduates became GPs. And if the situation would remain as such, it would be a mess now in the system. And now, with the new report in January, you will see the new the indicators, and the results are about 40%. And that's, I think, because the problem was raised by the HSPA and that it was considered as a real priority for the system. But we have also other examples. Appropriate care was put high on the agenda, raising topics like high medical radiation, about the problem of antibiotic consumption, the problem of overuse, of underuse. Other examples I could tell just as keywords are access. For example, we target marginalized population like alone pregnant women to make tailored projects for them to straighten the system.
I think, yeah, thank you so much. And I think there's a lot, especially on the GP, it's also a question of sustainability, right? You just mentioned vulnerable population groups, the equity component, which is extremely important, which is also being recognized as one of the health systems goals of the HSPA framework. Maybe my last quick question, being mindful of the time, some of the wisdom moving forward, going into the future, what do you want? What do you wish to see? You mentioned also the leadership, the importance of the political will of using HSPA reports to influence policy decision-making.
Well, I can't speak for the future, but I think with the new report you told about, which is coming out in January, there are several topics, new topics, which are coming out. For example, we took the results of the Paris study to put it into the HSPA about PROMs and PREMs. It will be one focus on patient experience. Another one is a new chapter on equity. There is also the chapter on the lessons learned about the COVID, and so all the dimension of resilience. And finally, governance is also a new topic in our report. And for example, the indicator we talked about yesterday is in our new report. A further topic which is already in our new framework is environment, but we didn't develop it yet. But putting that into the framework already now can maybe be easier to put it on the political agenda, easier for the next year. So I don't think I have to project myself within 10 years. I just can say that with all those new topics, it can change something in the next year on the political and policymakers' agenda in Belgium.
Great, thank you very much. And I think I have a little bit of a déjà vu of some of the actually updates we have done with the resilience, the environmental impact, also on the governance, the importance of also measuring governance. Over to you, Matthias.
Thanks, Kira. Thanks, Pascal. And now it's my great pleasure to introduce Helena Regnerova from the Czech Ministry of, she's Director General, Economics and Health Insurance Ministry of Health, Czech Republic. And you have first-hand experience with HSPA development. You just went through the phase. developing your framework and formulating your policy questions, your tracers indicators, choosing the particular data you need for this. And we would like you to share a little bit the challenges you were encountering, but also with a view towards stakeholders, you know, and what sort of leadership was needed from the Ministry of Health, from your side, actually, you know, to convince stakeholders, professional associations to come on board for all this. Please, Helena, fill us in.
So, thank you for inviting me, and thank you for excellent organization. I am happy to be here with you and to share experience and to hear so much. And in the Czech Republic, for us, it was really crucial from the beginning to build the trust in HSPA process and in the results. And we needed that various stakeholders believe its results, and even they accept ownership of the results, because it's crucial for the future, not to have only process, but to have also people who are behind it and who can use it and who can support us in this process. And we achieved this in 2 steps. First, the HSPA process is transparent and relies on credible institutions that sit in its high-level oversight board. And second, the indicator selection followed a lengthy participatory process with the backing of EU and OECD, which included all important stakeholders who had a say in the final HSPA framework. For example, medical professionals were included from the real beginning, and now they are avid supporters of the process. So in order to ensure implementation of the whole process in the Czech Republic, as I mentioned, we have established a special advisory board to the Minister of Healthcare on HSPA. This board meets regularly twice in a year and includes representatives of different stakeholders, including representatives of the Patients Advisory Board, Ministry of Finance, representatives of health insurance companies, statisticians, or public health professionals. And this special board is to provide advice on HSPA objectives, regularly review HSPA scope and purpose, as well as define HSPA deliverables and support dissemination. All reports of the Special Advisory Board on HSPA are, after approval, available to public through special web portal. Actually, we are still in the development process, so its results haven't yet had chance to influence policy. But I think it is a good sign that while the HSPA process started under the previous government, it is highly supported by the present government. And we also aim to align the release of HSPA report without political cycle. So we plan to release first report at the beginning of 2025, and it is just 1 year before general elections. And so we suppose that it can be information for political agenda for a new representation. And overall, there is a great demand from politicians for actionable evidence and international benchmarking. So HSPA helps to meet this demand. And maybe I can add some success which was based on data that we were able to persuade previous government to invest in education of healthcare professionals more. because we just presented the lines with the workforce and with the GPs over 60 and the percentage of leaving healthcare system being retired, and also nurses, lack of nurses also due to the age. So based on this data, we were able to persuade to invest in this education, and it is now in the process. And it takes some time because it is about 5, 6 and more years. But now we can accept more people, more students who went successfully through the entrance exam and previously stayed below line. And so it is our first small success. Thanks.
Helena, thank you so much. And we were really hoping that you would talk about all this, because it's almost like a blueprint of the governance and political side of implementing this. And it's also a bit of a preview of what we will have later when we talk about investment for health systems performance assessment, because these are exactly the investment decisions we want to make, targeted where we really need them, where they really bring about more performance in times of budget restraints. Fantastic presentation from your side. Can I ask you back? I mean, we are running out of time, but I think it's important. And you talked about, first of all, congratulations, no fake news. Everybody agrees to the facts. They all share the facts apparently in your country now. Lots of transparency. Has it contributed to trust? I know you cannot measure it, but is it kind of feeling, you know, when you say you linked it to the political cycle, it informs the next government and all this? Is it contributing to trust in your country?
I think so, because I think that if we have in the board people from Ministry of Finance and from State Institute for Public Health and so on, these people are on one ship, and also insurance companies, which are mainly state insurance companies in the Czech Republic. So all these people are now nearly our friends, and they share everything what was done. And I think that there is no obstacle when we present something, so they understand what we are saying, because we are not presenting emotions, but data.
Yes. Thank you so much, and thank you so much to the panelists. I think there was a fantastic panorama, actually, on the reality of health systems performance assessment. We had in the beginning more the theory, the concepts, the terminologies, and then the work of the Commission supporting countries and of OECD, and then how a country, you know, which is highly regionalized, works with the region, a country that has a lot of experience with health systems performance assessment and is continuing to work on it and probably even expanding this. And now your very encouraging current experience is fantastic. We will hopefully come back to the panel if we have time, but if not, please, a clap of hands for this fantastic panel. Stay. I said we are unfortunately running out of time. Kira, I think we skip the poll, but we would like to have questions from the floor that we feed back to the panelists, if you like. If there are no questions, okay, we can also do the poll, but we would prefer to have questions from the floor. Please, can I see hands, a show of hands?
And I think we have some volunteers in the back who would also be providing the microphones. But
yes.
We first need some volunteers.
We collect 3 questions and then pass them on to you. Don't respond to each question, just pick out the one you feel best suited to respond to. Where can I see some hands? All clear? Nobody wants to follow the countries here?
Or any reflections from your experiences?
Yes, please.
During the
from Belgium. There.
Okay. We have one hand over here, and then there's another hand over here.
Thank you very much. I was surprised to read on page 27 about health workforce that you have decided to also include informal health care in the definition of the health workforce. But when we look at the different indicators to capture this dimension, we only see professional workforce. So you did not identify possible indicators to capture this dimension about the support of informal caregivers in the population. So I see there a discrepancy because the definition is more broader than the indicators used to capture this dimension.
Great, thanks. Next question, please.
Thanks a lot. My name is Caroline Kostangse from EuroHealthNet, and I have a question about prevention and health promotion and how that's integrated in health systems performance assessment framework and in your work, because we need to boost preventative services very much, and I'm interested to hear.
Very good question. Thank you so much, Caroline.
Do we have another reflection, one or two, some hands coming up? Also to our country speakers, some of the reflections, I think the sharing of experiences is always very valid on some of the challenges that you may have faced on the same journey. I think the entry point, Matthias, actually, right, is always slightly different, but the challenges that we are facing and the new challenges around resilience, climate governance, I think is all very much high on our agendas to go forward.
Otherwise, we just go ahead. Would you like to start, Maya?
Okay, thank you very much. I want to respond to Caroline Costong's question because this was indeed the subject of a report that we did and that we published as part of the expert group on health systems performance assessment. And the starting point was exactly what you were saying, is how is prevention measured within health systems performance assessment. And what we found was huge diversity, because we started out by just asking the member states, so in your frameworks, or even if you don't have an HSPA framework, what indicators do you use? It was like almost a mapping. And from that, we found huge richness. There were some countries that focused very much just on screening indicators. And for them, that was the prevention, like secondary prevention in the health system. And there were other countries that had over 120 indicators on prevention. So I think it shows you the importance of the discussion in prevention, and where it actually fits in the spectrum, in the framework. We identified two kind of case studies, and I think it's important also to mention those, and it was something that I wanted to come back to, which is about health literacy. So really the importance now, this is bringing in this new aspect of how citizens and patients make up the HSPA framework, and the other one was on mental health. So I think it's very good to follow up there.
Actually, if I may add a personal experience, we used the country health profiles, previous issues of this with two countries to discuss health promotion, and how they are linked to health services and how to ensure the accountability and the uptake actually of it. Thank you so much. Mark.
Well, maybe I should therefore pick up on the informal care side of the argument, because I think that is incredibly important, not just because informal care is important in itself, but also because some of the areas where we're weak more generally in health data and performance assessment are things like gender. We're still not great in the health sector at looking at gendered issues, ethnicity, things like undeclared migrants, which obviously has a big impact with the informal care, even sexual orientation and so on. I can go through lots of the areas where we're weak. They kind of meet at the point where we're talking about informal care. It is difficult, of course, because even the definition of what should be included as social care and health care, again, it comes down to that point about whether we're talking about activities of daily living or instrumental activities in terms of definitions of the borderline, which become a bit messy. Nevertheless, clearly we need to make progress here. I mean, we did a report earlier this year called Beyond Applause, which tried to pull together all the evidence that we have on informal care. It's not great. I don't think we're yet there that we have a single indicator or even a single set of indicators which work well across all the countries. Nevertheless, we're not far off. I think there's a set of indicators where with a little bit more effort, we can probably move to be able to actually fill that gap a little bit more effectively. But I think that's a case of work in progress, and that's basically why you won't quite see it yet in tracer indicators. But I think any organisation, the OBS, OECD, WHO Europe, we're all incredibly aware that this is an area where we need to make some progress in order to be able to make meaningful comparisons across countries.
Thank you so much, Mark. Modesta.
So, for what concerning the question, we consider in our informal care is a huge amount of, it's a hidden phenomenon. We know it, but we not measure systematically. We have targeted survey, and so the one issue in our country was to try to educate them. So, but the issue is, if you educate them, you recognize them. So this is the matter that we are facing, but we know that long-term care is supported a lot.
Yeah. It's a very tricky area, but all countries also know that's a very crucial area, and that we have in Europe a health workforce crisis, and therefore I fully understand that you asked this.
Yeah.
And I think the interface between informal care and how informal care can actually be supported, by formal care and by health systems is absolutely crucial. But as we presented the dashboard, it's a test drive, It's to see how it works and have the policy question. Maybe we need to adopt in the future some of the policy questions and come up with further. Or we see this from country to country, that they say, we take the framework, we have a couple of questions which are fully aligned with our priorities, but we need to expand a little bit.
We think that it's very important that this framework has to be very adaptable and flexible. Accordingly, the difference of the country, but also of the different needs that are arising, and also the shocks that we will face. So it's really important that we all the experts will be able to readapt accordingly the emergent needs and existing needs.
Pascal, health promotion and prevention and the health workforce.
And prevention. In the early reports of performance in Belgium, health promotion was included in the report. But after a few years, we decided to put it out of the report and to build a new report on HSR, so health status report. And to keep all those different topics together, because they are quite important and interlinked, we put them on a website together, which is called For a Healthy Belgium. And in this website, you can have documentation on the health promotion and prevention on one side for HSR, and also on HSPA with the little part of health prevention, which belongs to the health system. And on this website, we put also policy actions from the HSPA, like appropriate care, together, so that you can have a bundle with all the information which is interesting about this topic in Belgium.
Okay, thank you.
For a healthy Belgium.
Okay.
Yes, sorry. In our HSP national, we have a framework, just a section dedicated to health promotion, and the financing is also related to health promotion, hospital care, and community care. So in health promotion, we have vaccination, screening, and all that. Yeah.
So it's no way outside, even if it may not be included in the test topics of it's for many countries really, really central, but sometimes the question is how to cut the cake and where to put the topic, but not to lose the topic at all. Elena, you just went through the process, and probably you have a vivid memory of all the questions, how to cut the cake, which tracer indicators to choose, and always knowing that the choice for one is the exclusion of another, that you need to prioritize a little bit, and then you need to keep it kind of focused, not too many indicators, not too many data. What is your experience with regards to the health workforce and health promotion and prevention?
As to our process of health promotion and prevention, I think that in spite of the process of HSPA, we have two ways how to support. We have supported national screenings of breast cancer and some new also tuberculosis and other areas. And all this is supported financially because it is paid from the insurance companies, and it is just the Ministry of Healthcare. We decided what will be supported by this payment. And on the other hand, our 7 insurance companies, which are somehow very similar, they have special prevention funds, and they issue every year their reports, what was spent on prevention. And it is for us also just the data, what helps. And there are other possibilities to choose something from the side of clients, so we can also see what they want to support. And in our process, I think it was difficult not to have so many indicators. So we have 10 areas and 28 indicators because we really went through the process to concentrate what is important for our country when we have the biggest problems and when we have gaps. It is just open for new evaluation, but I suppose that it would be helpful in this framework.
But Helena, maybe I can ask you back, Mark, on this one. Isn't that one of the beauties of the health systems performance assessment, that we formulate policy questions and then have tracer indicators, and they are selected? So it's not 10,000s of tables and completely boring things and things which are maybe of little relevance to policymakers, but really a selection and slimming it down to very few indicators, even if you lose some of the richness of others. Mark, please share your experience here.
Completely. I think that's one of the lessons of this. I mean, you can, every country out here, if you dig inside the sort of health data that the international organizations produce, you can find something that you're top on and something that you're bottom on. And that picking and choosing in order to justify particular stories that governments or political parties or pressure groups want to use, it's easy if you go through those lists. I think the point of the health system performance assessment, and the reason why the process that Helena's been through and talked about, all the different countries, to define what really matters for your country. These are the framework, these are the indicators that you agree across different stakeholders are the most important for your country. That's the key thing, because then it moves, as already has been said in this panel, it moves you from not just talking about the transformation, it moves you into the trust part of the argument as well. So you're agreed on what it is really matters for this country and how you're going to measure it. And so, yes, I mean, of course, we all have our most favored indicators that we really like. It's not really important. What really matters is that you as countries decide collectively what really matters for you, and you focus on those.
But also it means, Mark, that we are not asking countries to collect more data, but rather slightly better data, more accurate data, and more timely data. Is that? I see you nodding, Modesta. Maybe you want to come in on this one?
Maybe if I can come in quickly, because you mentioned as well the social participation bit, right? On some of the health literacy, the education. Are you thinking about some of the, I mean, I think we have the trace indicators, they are great, but there are also a lot of areas where we still need certain other indicators, maybe sometimes also those qualitative indicators, maybe some reflections. And I think this links also a little bit to Pascal, who has done actually in Belgium quite a lot of updates on the governance indicators. But Modesta, please, if we can have some reflections from you.
Yes. We are working of data coherence and data accuracy. So what we are investing in reinforcing our data infrastructure, health data infrastructure, and we are doing that in order to use data also using stratifications and using that data for policy to be more informative at different level with the region, with our chiefs, with our ministers. And what we are doing is also work with our GDPR guarantees for privacy matters, that it's a big issue also in order to use interconnect data and use more for reliable data. And so this is our huge effort in that moment. Yeah.
Fantastic. Very briefly, Pascal, please.
Well, when you say we don't need more data, okay, if there is a new topic like environment, we especially need a new list of indicators about that. But I think the most important thing is that we need international comparison, because policymakers want to compare themselves to other countries, not to compare to see the level vary each other, but also to understand, okay, there's something else in this country, maybe I can learn from this country. And this exchange is, I don't think, until now, very poor. Because I think we need more HSPA in each country to compare ourselves and to learn from each other.
Very
so
good. The benchmarking is really an integral part and informs really the debate in countries, and we need to make sure that there's enough comparison possible.
In our dashboard, in terms of transparency, we want to put also the international side in light. So with national, regional, but also international, so all together.
Very good, thank you. I think there was one more question. Was it from Germany?
Yes, hello. Yes. Can you hear me?
Yes.
Okay. Yeah, Philipp Walzer from the German Ministry of Health. Yeah, thank you for this very interesting plenary. We in Germany, we are currently finalizing our HSPA report. So we're piloting an HSPA with 60 to 90 indicators, depending on how you count. So right now we are in a phase of thinking about implementation, and I definitely think the new framework of the observatory is a step forward in a way that it's a more analytic approach to the issue of HSPA, and also to show like the interconnections between different parts of the health system. So I definitely think this is like a innovative step forward for the discussion. Still right now, well, the major challenge that we have in Germany is thinking about innovation, implementation of HSPA. So, and also how to make it also relevant for policymakers, because I mean, HSPA is only worth something if it's considered into policy making. And so this might be something that I would like to ask the panelists if they have some advice how to make HSPA relevant to policymakers, because when you have like the HSPA report itself, how do you force policymakers to make use of it?
Thank you so much for this very encouraging comments, and I can understand that sometimes conceptual frameworks are a little bit tiring, but if you do real comparison on it, if you make decisions on it, you know, investment decisions as we have heard, then you need to get your terminologies, your concept right, and you must be sure what you're talking about. And I think the frameworks are actually there. And thank you so much for these encouraging comments. Maybe a very quick round on this one, and then we wrap up. It's very much on the implementation side, I think. You know, we don't need to convince you. You have heard enough examples from the countries how important it is. Please, Maya, would you like to start?
Yes, no, thank you, Philip, for the question. I would say two words. One is data quality. I think it's very, very important. You can have a beautiful framework, but if you can't use it because you actually don't have the data. So for me, the big plug would be invest in data. I'm very happy to hear that Italy is doing that. The other thing is relevance and pertinence. So I think the fact that we've heard now that issues around environment, the greening of health systems, how the health sector can mitigate climate change, these are all issues now, workforce, that the ministers of health are dealing with. So if they see that there's already a framework that has those encapsulated, I think that that's the way to go. So relevance and data quality.
Thank you very much, Maya. Over to you, Mark.
I think
Brief, to the point,
yeah, I think
2
I'm
key messages, great.
Likely to repeat it. I think one of the things we have to be very careful with these frameworks is that we match them to what is needed by policymakers. And often, in the past, we haven't particularly done very well on areas such as mental health. We've talked about environment. We've talked about patient-centeredness. And so I think, as long as the indicators in your performance assessment framework match what policymakers are interested in a coherent way, it's not that difficult to get policymakers to use them.
Yeah, when evidence is evident, the policymakers are easy to convince. The struggle is when you have to convince, for example, concerning equity or minorities. So there is the big issues for technicians to try to be familiar and to take the right decision. So it's just auditing, peer reviews, and try to involve in the process of the results of the the policymaker familiar with the matter. So inform them on the matter, on the importance of that. Yeah.
Pascal, your key takeaway.
Yes, I already answered the question, but I think the main topic is in the beginning of the HSP in Belgium, we asked to the policymakers what they wanted into this report. And the second thing is that they are involved also in the process of elaborating this report with accompanying the evolution of the report, the results of the report, and there is always an interaction. But we have to take all the policy makers together around the same table, and I think it's easy because HSPA is an overall shared dimension where you can't be against.
So I think that even politicians sometimes ask for the data, some kind of data. Just now we are many problems, as you also striking medical doctors not to make so many overtimes. And when we are in this situation, the politicians come and ask for the data, and they would like to have comparison, to have benchmarking with other countries where we are for the moment. If we are really underestimate our possibilities, or what is real status, because it is much more discussion about emotions and not about facts. And I would like only to add to my previous answer that we have 28 subdomains, but actually we have more than 100 indicators. So it's just to add. Thank you.
Thank you so much. And I think it's time to wrap up, Kira.
Yeah, thank you very much to all of our panelists. I think it was a very rich discussion, and I actually also have an anecdote. When I was starting on the journey on HSPA, I had a very interesting conversation. And the person basically in charge of doing the HSPA, they were like, oh, I got so excited with our team. We got into details. We pulled all the different data sets, but then we ended up with a 700-page report. And the question was then, of course, but how do we make policymakers to read it? So I think it's also about unpacking, doing the communication, highlighting, synthesizing what you have just reflected as well on which indicators to use, which are relevant. Pascal, you mentioned also to be quite strategic. One of those reports will be launched in order to then influence certain policy decision. And I think the renewed HSPA framework is a great tool, a practical tool in order to help everyone, policymakers, to orient data, to plug in the different indicators into the boxes of the functions and the sub-functions, to think about those assessment areas that brings us closer, not just that description, but really the analytical analysis of how we can actually use and analyze those data moving forward. And I think for me as well, Matthias, the tracer indicators, I think that is very important in terms of moving forward. Certainly, we may not have all of the answers to the policy questions, and there needs to be more work, but I think it's a great starting point in order to then also allow for a subset of indicators to have this comparative analysis across countries in order to then also have that data transparency, the sharing of experience. So I think that's from me, from my side.
Thank
Over
you so
to you.
much, Kira. In any case, what you say, I think it's a big encouragement of reading the briefs, in particular the dashboard policy brief, like our Belgian colleagues, that you can have a look how it actually works and how little indicators it is in the end, and how much it already tells you. And I'm quite happy because for me, I think that the panel and the presentations have shown that there are frameworks. There's a framework which you can really use, and it's thought through, even if it looks sometimes a bit complicated, it's necessarily so. And I think you can really use it. And I think the panel has also demonstrated, that it's a driver for transformation. A driver for transformation, bringing forward health systems and health systems performance. And like as a preview of what is coming this later today, investing in the health workforce, investing in health systems targeted for performance improvement. I think that's a really great thing. And as you said, policy question, tracer indicators, data, all this needs to be, of course, in place. But I'm quite confident now, and thank you so much for the panel. Thank you so much from the audience, and I hope you found it as interesting as we do, and I think there's a lot of things to follow up over the next couple of sessions. So thank you. Bye.
Thank you.
One thing for housekeeping, I think the bus times have changed, the bus schedule. I think the bus is leaving a little later. You will get more information later on.
Thank you.
Thank you.
Hello.
Tere.
Hi. Tere.
Tere.
Tere. Very good. You don't need to go.
You're going to dance with us?
You can dance with
stay.
us.
You can stay on the stage. We're going to dance. Don't leave.
Tere.
Tere.
Good morning. How are you? Tere.
Remember us, Tere?
Tere.
Oh, Tere.
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 How are you?
How are
Kuidas
you?
teie tervis on?
Kuidas
How
tervis
you
on?
been? How is your health? Tervis? Remember that?
Oh,
Good.
I have something.
Lahe. Lahe.
Palun.
Aitäh.
Aitäh.
Aitäh. Remember
Aitäh.
that?
Remember
Aitäh.
yesterday? Aitäh.
Aitäh. An apple a day keeps a doctor away. Yes? Well, we want to thank you for speaking with us yesterday in Estonian language, for visiting our table there, drinking birch sap with us. It was lovely to see how well you remembered the words we taught you. And today, we're going to take it even level higher. Now you're like fluent Estonian speakers. We're going to make you Estonian dancers. So we're going to learn a small Estonian dance. I will quickly show you on the screen what we're going to learn. So video palun. Just
If you move, you are healthy.
Karga välja kaema, kas on kesvad keerulised, kaerad kasvanud kandilised, kas on kesvad keerulised, kaerad kasvanud kandilised. Kaerajaan, oi kaerajaan, karga välja kaema, kaerajaan, oi kaerajaan, karga välja kaema, kas on kingas kaevu
nothing difficult, right?
Yeah.
So if you could just all stand up. And we're gonna learn a few steps. It's gonna be fun. I'm sure you've not had your morning exercise yet. So first of all, we need to move our feet a little bit like scissors. You move like this. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. It's slow and slow And quick, 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 quick. We do it twice. And that's half the dance. You already know half the dance. Now comes the second half, which is much more easier than the first half. It's clapping. We do 1, 2, 1, 2, 3. Then you join hands. Join hands, yes, move together so you can join hands. And move your hands forward and back. 1, 2, 3, 4, 5, 6, 7, 8. Now we clap again. 1, 2, 1, 2, 3. And 1, 2, 3. Actually, there's only 4. We can't do 8. There's only 4. And the music is crazy quick. Crazy quick. So we can practice it all together. I show you a way to cheat. If you don't want to jump, if it's too early for you, then you can just use your heels like this. 1, 2, 3, 4, 5, 6, 7, 8. Just 4 heels. Right, left, right, left. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Okay? Do we know it now? Should we repeat it or just put on the music?
Let's make a dry run.
Dry run.
Yes.
Once. Okay? We start. Oh, you can put your hands here. Yes. It's a very old-fashioned. In the video, they also put it here. But this is older. This is more Estonian, actually. So we start with the feet, right? 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, and clap. 1, 2, 1, 2, 3, 4, 5, 6, 8. 1, 2, 1, 2, 3, 5, 6, 7, 8. Did you get it? Yes.
And it goes like this 2 hours.
Yes. Or until the morning.
Yes.
Okay, but we can do it with the music now. You're professionals, right?
Yep.
Yes.
Are you ready?
Video, palun.
Oi kaerajaan, oi kaerajaan, karga välja kaema, kaerajaan, oi kaerajaan, karga välja kaema. Kas on kesvad keerulised, kaerad kasvanud kandilised, kas on kesvad keerulised, kaerad kasvanud kandilised. Kaerajaan, oi kaerajaan, karga välja kaema, kaerajaan, oi kaerajaan, karga välja kaema. Kas on kikas kaevu läinud, kaerajaan ta välja toonud, kas on kikas kaevu läinud, kaerajaan ta välja toonud. Niimoodi.
Can you continue?
Kaerajaan, oi kaerajaan, karga välja kaema. Kaerajaan, karga välja kaema. Kas on Kaie viga saanud, et ta valjult kiljatanud või mis on Kaie viga saanud, et ta valjult kiljatanud?
And the most important part. We bow. Aitäh! Excellent! Thank you so much. Now you know how to party in Estonian style.
You are best dancers.
The best dancers.
Yeah.
When you go clubbing tonight, just remember, yes? Dance like an Estonian.
And come to visit our desk as well. We have more birch, sap, and dried apple. And next time, see you on Sun Festival because they know the dance already. Kaerajaan, see you on Sun Festival.
Head aega!
Head aega!
Head aega!